Hello and welcome to the Medicine Safety Video Podcast. Now, back in October we issued a clinical alert which talked about the need to take care when administering the drugs Pregabalin and Gabapentin, and we're just going to talk a little bit about that alert today. So Pregabalin, some of you may know it by its brand name, Lyrica or Lyrica. Gabapentin, mostly used in the generic form now, but you may still hear it referred to by its brand name Neurontin. And you'll notice that the name of both of these medicines have the letters GABA in it, and that's because both of these drugs bear a structural resemblance to gamma-aminobutyric acid, or GABA for short. And GABA is a compound that occurs naturally in the body, and it's actually the central nervous system's main inhibitory neurotransmitter. So firstly, Kevin, it might be good just to start by telling people what these drugs can be used for.
Sure, Alan. They're basically used for three things. First thing is for treating seizures. Secondly, for treating a special type of pain that some patients suffer from, called neuropathic pain. And thirdly, more recently, they've been used to treat generalised anxiety disorder.
Yep, so Pregabalin's licensed for generalised anxiety disorder. So the drugs can be used both for physical health conditions and mental health conditions, and they're quite commonly used drugs, actually. We published the clinical alert because we wanted people to be aware of two main facts, and the first of those was that these drugs are open to misuse. And I wonder, could you tell us a bit more about that?
Sure, we've become increasingly aware that these drugs are open to misuse. They produce euphoria, so they make patients feel euphoric, happy, more comfortable. We do know that these drugs are misused on the street. We know that people are becoming dependent upon them, and also they have a street value. So patients may be able to sell the drugs on the street to other drug users.
And there's actually been a call to reclassify these drugs as Class C controlled compounds.
Correct, yeah.
So I guess it's just really important for people to be aware that service users may be misusing these drugs, and that could be a supply that they obtain either from their GP or illicitly.
Definitely.
So the second point that the clinical alert tried to highlight was the fact that these drugs can cause central nervous system depression, CNS depression, and I wonder, could you maybe explain that term for us, Kevin? So CNS depression, it's nothing to do with low mood.
It's nothing to do with low mood at all. What happens when you develop CNS depression is that your breathing rate goes down, your heart rate goes down, you start to lose consciousness, you may actually slip into a coma, and in a few tragic situations, patients have died from taking an overdose of these drugs. So it's a very serious side effect, and you need to act on it immediately if you see a patient suffering from those symptoms.
And there are other drugs that cause CNS depression as well, and that the effect of those drugs can be additive if people take them with Pregabalin and Gabapentin. So what might some of those drugs be?
Some of those drugs will be alcohol, for example, very commonly used, causes CNS depression in its own right. Medication used to treat anxiety, so anxiolytics, benzodiazepines, and antipsychotics as well. So all those three drugs, plus the ones appearing on the slide, are drugs which will add to the effect of the Pregabalin, Gabapentin.
Yeah, and opioid painkillers is another big one. Things like methadone as well, which are commonly used in this trust. Really important that we pay attention to these drugs, that we make sure we know when people are taking them, and we avoid other CNS depressants if possible. So you can read the clinical alert, that's on the intranet now. If you just search for Pregabalin, you should be able to find it. But until the next time, thank you, Kevin, and thank you for watching.
Thank you very much.